Today I have a very special speech for you. This speech is very dear to my heart. And first, I want to talk about something that everybody has experience with. Babies. Babies are such a blessing to everyone. Wherever you go, wherever you see them, everybody wants to touch the baby. Whether it's the grocery store or your neighbor's house, you're either playing with the baby, talking to the baby, or wanting to hold the baby. In fact, here's a picture of my baby. She's 1.5 years old, and she was born spirited, full of energy, and perfectly healthy. But not all babies get this start to life. Here's another baby that was born struggling to breathe, overall unhealthy, and underweight. But why? What is the difference between my healthy baby and this baby? These babies were not given the same start to life. In fact, this baby has a very, very serious condition known as fetal alcohol syndrome. Feminist movements of late have given the power to the statement, my body, my choice. But what if your choices impact a body that's not your own? And what if the body is a baby that will suffer immensely because of one choice that could have been preventable? Fetal alcohol syndrome is one effect of drinking while pregnant that can have irreversible side effects. The CDC and the Oxford Medical Journals both agree that many women in America are at a high risk of fetal alcohol syndrome. In fact, 1 out of 1,000 live births are said to have a diagnosis of fetal alcohol syndrome. The CDC and the Oxford Medical Journals consider this a high-risk problem for many women who have mental health problems as well as other issues running through the family. Today I'm going to talk about 3 main points. We're going to learn what fetal alcohol syndrome is. We're going to learn how it affects children from birth until they're in the adolescence. And we're going to learn how to prevent it if you need help and where to get that help. Fetal alcohol syndrome is something often heard about but rarely understood for how detrimental it can be for a lifetime. But what causes fetal alcohol syndrome? Fetal alcohol syndrome is caused by a mom who drinks while pregnant. A lot of people ask, well, how much can I drink? Can I have 1 glass? Can I have 1 glass a week? Can I have 1 glass my whole pregnancy? 1 a month? The answer is it's not known. So you might as well just say that you can have none. 1 glass might be too many for your baby. What can you look for while pregnant? What can you look for in someone who is pregnant to prevent this awful disease? Someone who craves alcohol, someone who drinks an excessive amount of alcohol, someone who says it's okay to have 1 glass with the meal, someone who had a drinking problem before they were pregnant, and someone who might be in excessive denial of being someone who drinks while pregnant are all things to look for when it comes to fetal alcohol syndrome while the mom is pregnant. Fetal alcohol syndrome doesn't just go away once the baby's born. It can leave lasting damage physically, developmentally, and emotionally for years to come. First, we're going to talk about the immediate effects from birth until age 2. These problems might persist afterward, but these are the main things for this age group. Please note that any of these symptoms may continue into adulthood. The first thing a baby might go through is withdrawal. A baby will go through all the withdrawal symptoms that an adult does coming off of alcohol. They're addicted essentially to the alcohol that they were getting in their mom's tummy. Physical things you can look for with a newborn baby is that the area right here will be smooth. It will not concave like it does in a normal baby. There's going to be a wider space between their eyes and a thin upper lip. They will be severely underweight and possibly even under the height. This is considered less than 10th percentile when it comes to height and weight. They might have a disproportionate head size through their toddler years that is significantly smaller than their body or even significantly larger. They're going to be unable to suck, potentially, and have a hard time eating. They may even require things such as a feeding tube or other medical necessities. Problems, though, persist past age 2. They can persist into childhood. Some important things to look for as your kid enters preschool and kindergarten include memory issues. They might have a hard time remembering to brush their teeth, remembering their animal's name, remembering what they were doing last. You can see that they're developing sensory issues. They might not like certain tastes. They might not like certain feels. Certain feels might tick them off a little bit. They might have poor social skills. They might not want to interact with toddlers as much. They might not want to interact with kids their own age. They'll most likely stick to themselves because they just don't know how to communicate well and play well together. They might have trouble speaking and developing a good conversational habit. They could have low muscle tone and have an inability to develop muscle over their whole lifetime. They could have poor coordination, meaning that they could have a hard time writing, they could have a hard time playing with their blocks, or they could even have a hard time just putting on their own clothes. Their learning and IQ delays are also significant. Their IQ is going to be lower than their average peer, and their learning is going to take a lot longer for them. ADD and ADHD are also common side diagnoses that come with fetal alcohol syndrome. A lot of kids with fetal alcohol syndrome will also get diagnosed with ADD or ADHD in their lifetime. Continuing on, we're going to talk about problems that arise into adolescence and into young adulthood. These include poor organizational skills. These can also go on and persist into adulthood. You can see that teenagers might have poor planning skills, and they might have a difficult time following multiple step processes. Poor judgment is also a big sign of fetal alcohol syndrome in later years of life. And the inability to apply knowledge to new situations is also poignant in how a fetal alcohol syndrome diagnosed baby might act in their later years. While fetal alcohol syndrome can be very scary and hard to deal with, it's important to know that it is very much preventable. If you or someone you know has fetal alcohol syndrome, there are some very serious signs to look for. These include drinking, prior alcohol problems, family that might have had a fetal alcohol child, family that might have had a drinking problem. These are things that you want to look for in loved ones so that you can help them get the help that they and their baby needs. Here are some numbers and resources to help you in your pregnancy. If you are having trouble struggling with drinking alcohol while pregnant, reach out to family. They're your first go-to. If your family isn't someone you can reach out to, then you have friends who want to help you. You have friends who want you to have a healthy pregnancy and a healthy baby. If that's not an option either, consider rehab. Rehab is a great place to pull yourself away from your family and friends and to truly get the help you need. You can talk to your doctor too. OBGYNs are there for you. They're there to make sure that you have a healthy pregnancy and that you are healthy yourself. Finally, 1-800-622-HELP is a helpline for you if you have no one else to get to, or if you just want to be anonymous and talk to someone about your problem. Remember, it's your choice. It's your life and it's your baby. Do what you need to do to get the help that you need. With all that has been said, fetal alcohol syndrome is preventable and can leave detrimental effects for years to come. Don't be afraid to ask for help or know where you can get help for someone who might be struggling with this. One drink can change a life. Don't let it be a life that hasn't had a chance to live. At this time, I'm going to open the floor for any questions that people might have in the audience.
I have a question.
Yes.
Is there a cure or treatment for fetal alcohol syndrome?
The only treatment right now is therapy and any medical things that might need done, including feeding tubes and occupational therapies. Oftentimes the kid is going to need a special needs class just to catch up to their peers, but at this time there's not a secret pill that a baby with fetal alcohol syndrome can take and magically cure everything. They're going to struggle with it for the rest of their life.
I have a question.
Yes, sir?
Can fetal alcohol syndrome pass genetically?
No. Fetal alcohol syndrome does not pass genetically. This is something that's passed in utero, meaning that the mom was drinking alcohol and it passed on to the baby, and the baby suffered the side effects of the alcohol. Now, there are things that can pass genetically, such as a high chance for having alcoholic tendencies or having addiction problems in your family. If you know that these running your family, it's important to be sure that you are taking care of yourself and watching out for these signs and symptoms. Remember, one life doesn't have to be changed because of your poor choices during your pregnancy. You can get help for you and your baby. Thank you for listening to my speech. I hope you learned a lot.